This is a presentation of pharyngitis and chronic kidney disease, and I'm Elizabeth Thompson.
And I'm Skylar Napper.
The patient's chief complaint: I have a sore throat and it's hard to swallow. I feel tired and weak and I have a bad taste in my mouth. Also, my kidneys aren't working good. Subjective. This includes a history of present illness. This 65-year-old white male presents to the office with complaints of sore throat and difficulty swallowing for the last 2 days. Burning he describes when swallowing, which he rates the pain 6 out of 10. Worsened by eating and unrelieved with lozenges. The pain does not radiate. Generalized fatigue, weakness, anorexia, not sleeping well, and metallic taste in his mouth for approximately 1 month. States he has been taking Tylenol 1,000 milligrams BID for a low-grade fever for the last 2 days. He denies cough, cold symptoms, or ear pain. Recently retired, and he lives with his daughter and grandchildren. Review of systems, past medical history. HEENT. Denies seasonal allergies, denies a history of sinus infection, facial pain, pain around the eyes or tearing, difficulty hearing, or autoria. Neck. Denies pain or tenderness. Cardiovascular. Denies chest pain, palpitations. He does have a history of hypertension for the last 5 years. Respiratory. Denies shortness of breath. GI. Denies nausea, vomiting, and heartburn. GU. Denies urinary urgency, hesitancy, or frequency. He does report decreased urinary output. Endocrine. History of type 2 diabetes for the last 10 years. Integumentary, complains of itchy, dry skin. Surgical history. He had a cataract removal from both eyes 5 years ago. His family history: mother is deceased at 80 years from cardiovascular disease, father deceased at 70 years, chronic kidney disease, hypertension, and diabetes. He has 1 living sister. She is alive and well with no medical problems, and the grandparents are unknown. Social history: he is a veteran. He denies illicit drug use. He smokes a half a pack of cigarettes a day for the last 20 years. Alcohol: he drinks 1 to 2 drinks every day. He has no allergies. He got a flu shot 2 months ago, and he takes lisinopril 10 milligram tabs by mouth every day and Novolog insulin 10 units subcutaneous injection every day.
Objective exam. The general survey and assessment. This is a 65-year-old man who appears in no distress. Patient appears to be stated age, well-groomed, slightly fatigued, and shows signs of wasting. Patient notes to be scratching his skin. Vital signs. His height is 165 pounds. Blood pressure is 135/84. Heart rate is 62. Respiratory rate is 18. Temperature is 99.9 oral. HEENT. Hair is of average texture. No history of head injury. Eyes, he wears glasses. No other symptoms. Ears, his hearing is adequate. Auditory canal has some hair with yellow to brown cerumen. Eardrum, pinkish gray in color, translucent. No sinus tenderness noted. Nose, no drainage or symptoms. Throat appears red, tonsils red and enlarged with tonsillar exudate. Present. Cervical adenopathy noted. Urine odor to breath noted. Respiratory, no cough, wheezing, or shortness of breath. Bilateral breath sounds clear. Cardiovascular, S1 and S2, RRR. GI, abdomen is soft and non-tender. Bowel sounds active. No palpable masses or hepatosplenomegaly. No CV tenderness or percussion. GU, prostate exam was deferred. Integumentary, skin is pale and dry. Some ridging of the nails. No skin lesions. Mild peripheral, non-pitting edema is present. Neuro, no peripheral neuropathy. No altered mental status.
Differential diagnosis. Pharyngitis. Differential diagnoses for pharyngitis include upper respiratory illness, tonsillitis, mononucleosis, peritonsillar abscess, and epiglottis. for chronic kidney disease include acute renal failure, medications, creatinine supplements, and protein supplements.
Education and diagnosis. Pharyngitis, an acute inflammation of the pharynx and tonsils. Risk factors are age, crowded conditions, daycare and school attendance, family history of rheumatic fever, and chronic illness such as diabetes. The most common symptoms are a sore throat, pharyngeal edema with tonsillar exudate, tonsillar enlargement, malaise, and prevalence is mostly in school-aged children.
Pathophysiology and etiology. Pharyngitis. Pathophysiology for pharyngitis is bacterial or viral disturbance of the pharyngeal mucosa causing an inflammatory response and infection. The etiology can be viral or bacterial. Viral causes are rhinovirus, adenovirus, parainfluenza, or Epstein-Barr virus. Bacterial causes include group A beta hemolytic streptococcus, influenza, Haemophilus influenza, Mycoplasma pneumonia, Chlamydia pneumonia, or Neisseria gonorrhea. Chronic kidney disease pathophysiology. Damage occurs in the small blood vessels of the kidney, usually related to increased blood pressure or chronic disease. Etiology includes glomerular disease, vascular disease, cystic and congenital disease, toxic exposure, renal tubular disorders, kidney transplantation, and renal artery stenosis.
Pharyngitis. Here's some of the etiology and the causes of acute pharyngitis. Chronic kidney disease. Here's some photos of the causes of kidney disease, and here's a kidney versus a kidney with kidney disease. Management plan. The management plan for pharyngitis, you would start with your diagnostic test. Treat patient according to their center score. Obtain a CBC and a monospot test. Medications would be penicillin V, 250 milligram, 4 times daily, by mouth for 10 days. You can also take acetaminophen and NSAIDs to relieve pain. Patient education of this medication will be watch for hypersensitivity reactions. It can make birth control pills less effective, and give 1 hour before and 2 hours after meals. Management would be encourage fluid intake, warm salt water gargles, and throat lozenges. Follow-up is usually not needed.
Management plan for chronic kidney disease includes diagnostic testing. These tests include estimated GFR, microalbuminuria, proteinuria, hemoglobin A1C, CBC, CMP, urinalysis, BUN, creatinine clearance. Medications include ACE inhibitors or ARBs and statins. Side effects of medications. For ACE inhibitors, side effects include dry cough, hyperkalemia, and fatigue. For ARBs, side effects include dizziness and sexual dysfunction. For statins, side effects include rhabdomyolysis, muscle pain, liver damage, and kidney failure. Patient education includes diabetes management, modification of diet, quitting smoking, abstaining from alcohol, medication education, as well as signs and symptoms of rhabdomyolysis, monitor output, blood pressure, and blood glucose, may take PO Benadryl for itching, use a daily moisturizer for skin, referral. According to Dynamed, early referral to a nephrologist is associated with reduced mortality. Follow-up. This patient is going to be referred to a nephrologist within 2 weeks and then returned to our office within 4 weeks.
Health promotion. Consuming a healthy diet, maintaining strict glucose controls, monitoring blood pressure, reducing stress, getting adequate sleep, and exercise. Disease prevention. For chronic kidney disease, we'd start off with weight management, smoking cessation, alcohol cessation, tight glycemic control, and hypertension management. For pharyngitis, avoid contact with sick people, good hand washing, and no sharing of drinking glasses or eating utensils. The family health model. The family health model pertains to this patient in several different ways, especially since the patient lives with his daughter and his grandchildren. Functional. This could be used in how the patient interacts with his daughter and his grandchildren and how they function together in the same household. Contextual. This patient may have some problems with this as he is not with a spouse or a significant other and is living with people not in the same life cycle.
Prescription for this patient, it comes from the ACP guidelines. The patient needs to be started on a statin. So we have prescribed simvastatin 20 milligram tabs PO every day, and to dispense a total of 30 tabs because the patient will return to our office in 4 weeks. Also, we're going to prescribe penicillin V 250 milligram tabs PO 4 times daily for 10 days, and we're going to dispense 40 of those with no refills. As far as ICD-10 codes, I've listed 3: hypertension with renal unspecified, and then diabetes type 2 and chronic kidney disease. These are our references. Thank you for listening.